I'm Aimee Voth Siebert. I work here at the Department of Public Health and Environment for the state of Colorado. I think the health and social sector is all about humans. The way that humans experience disasters before, during, after, in their bodies, in their brains, but also in their families and in their neighborhoods. It's thinking about providing care for people's well-being, for their relationships, and how it is that we're going to relate to one another in the middle of all of this disruption and chaos. So our team has a lot of relationships across sort of the traditional healthcare sector. So hospitals, our local public health agencies, community mental health centers, and then a lot of other first responder groups like our EMTs and firefighters and police officers. In my opinion, the other sectors, housing, economics, infrastructure, they all interact with health because effectively those things have an impact on where people live, where they work, where they play, and that's where health happens. I think resilience in the health and social sector really has to be tied to this larger idea of health equity. So equity is basically this idea that everyone, regardless of who they are or where they come from, has this opportunity to thrive, to have good quality of life in their communities. And so there are barriers to that people experience on a regular basis, be that poverty or the criminal justice system or education, that have then effects on the quality of health that they experience. In the health and social sector, some of our stresses or shocks would be when the disaster itself disrupts people's ability to get their medicine or to have health services available, or maybe like during the floods in 2013, the floodwaters actually broke one of the sewer lines, and so then people were without flushable toilets. One of the ways we have been trying to improve resilience is to make sure that data and partnerships about our community are pulled into emergency planning sooner. So the Colorado Community Inclusion Maps help people think about who makes up my community, where are they, and who are the partners that already have connections to these places. And by connecting them to that data and to these ideas about different partnerships, they can bring more people to the table when it comes to emergency planning, emergency training, emergency exercise. So we get feedback from the community about whether what we're doing is actually working for them.